So here's my speech notes. All right, so today I'm going to be giving an informative speech about paraphrasing. So I work at a daycare, and when the parents ask me to do something different with their child's schedule, I restate what they say in a way that indicates that I am understanding them. What I'm doing with these parents is a strategy called paraphrasing. Knowing how to paraphrase is critical to becoming a highly effective listener. Don't you want to hear what people say and understand what they mean? So today I'm going to teach you how to use paraphrasing. I'm going into the healthcare field and will be relating paraphrasing to my future career. We will discuss in depth what paraphrasing is and why it is used in listening, then discuss why paraphrasing is important in the healthcare field, and lastly, I will give examples of paraphrasing. So, paraphrasing is the ability to restate what people say in a way that shows that you understand them. According to an article on ProQuest written by Mr. Edwards, an assistant professor in the Nursing and Allied Health Department at Indiana University of Pennsylvania, explained that paraphrasing is summarizing whole units of an individual's behavior. It is a mirror of an individual's thoughts, feelings, and or actions, providing a clearer picture for the person and also the helper. And also, according to our 2015 Think Communications book written by Dr. Engelberg, who works in the speech communication department at Prince George's Community College, explains that by using paraphrasing, you go beyond the words you hear to understand the feelings and underlying meanings that go along with the words. So paraphrasing is a listening check to be sure that you know what someone means. Now I will talk about why paraphrasing is important in the healthcare field. So in the book, again, Communication Skills for the Healthcare Professional, written in 2011 by Lori McCory, who has her PhD, states that paraphrasing back to the patient what the patient has said provides the healthcare professional with an opportunity to verify that they have understood what the patient has said. So, by paraphrasing, the healthcare professional is allowing the patient to either confirm that the healthcare professional has the correct information, or they point out inconsistencies or gaps in the information and then clarifies for them. So, paraphrasing what a patient has said helps build trust between the patient and the healthcare professional. So the patient listens to the healthcare professional and paraphrases, checking to see that the paraphrase is what the patient intended to say and that the healthcare professional understands them. Paraphrasing what the patient says reinforces that the healthcare encounter is occurring for the purpose of helping the patient. So in paraphrasing, the healthcare professional should also try to convey something of the emotion that is inherent in what the patient said. Finally, I will discuss examples of paraphrasing in various conversations. So paraphrasing can be complicated and messy situation in the healthcare field. So consider the following example of a 16-year-old female high school student who shows up in the orthopedist examination room complaining of knee pain. So here's the example. An orthopedic nurse is with the girl evaluating her before the doctor arrives, and the girl's mother is also there. The girl is clearly distressed. The nurse can see that she has been crying, and the girl's mother, who wears an angry expression on her face, sits in the room in the chair, and she just kind of has a blank expression on her face. So the girl says she just has to do anything she can to make this varsity soccer. And her speech is very rushed. You can tell she's very nervous. And she said, "I'll just die if I don't. I'll disappoint everybody." Then she glances at her mother for a second, and then she continues. And she says, "Every time I lift my leg to push the ball on the inside of my foot, my right knee pops and turns to the right." And she says it hurts so much. And she just falls down. She looks again at her mother and asks her, "Mom, did this happen to me? Did this happen to you when you played soccer?" And that's the end of the example. So the nurse should remember that, first of all, why the patient has come in, just for the complaint of a knee pain. The nurse needs to focus directly on that one, paraphrasing the girl's words. She can't acknowledge that clearly there's some mother-daughter things going on there as well. And so she needs to be mindful not to really acknowledge that, because that could damage the communication process. She needs to stick to the knee pain. So when paraphrasing, like I said, she needs to stick to the knee pain and show the patient that she understands her knee pain. And the nurse shouldn't mention anything about the girl's distress about failing, because that is not what she needs help or what she came in for. And so, overall, I have discussed what paraphrasing is and why it is used in listening, or in the healthcare field. And I said why it's important in the healthcare field, and lastly, I gave an example of paraphrasing in the healthcare field. So, with this new knowledge you now have about paraphrasing and a different type of setting it is also used in, I hope one day you can use this strategy to enhance your conversation. Thank you.